You're gonna wait for the lag to go. Redirecting to Facebook. Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. My name is Dr. Keanu Shaw. I'm a proud dentist and will be serving as the moderator for today's Hex Commission meeting. The meeting is called to order. In representation of the noble professions are Dr. Gerard Morris, Medicine, Dr. Emily Letron, Dentistry, Dr. John Kryak, Pharmacy, Dr. Andrew Reuter, Optometry, Dr. Alan Chong, Chiropractic, Dr. Ora Mbarus, Philosophy. Welcome. The Global Summits Institute was founded based on the idea that doctors should be overseeing and administrating the healthcare industry. What has perpetuated the formation of the Hex Commission was years of listening to our colleagues complain about their common problems, but not much has been done or offered in a cohesive and structured effort. To advance our mission and vision, we have partnered up with our colleagues from other healthcare professions. And in the future, we will be rotating moderators and representatives to bring their perspectives to the table. It is important to note that we are healthcare. We also have other major talents, such as many of Dr. colleagues are accountants, lawyers, public servants, innovators, and more. We can create a sustainable and self-sufficient system to overcome all of our challenges. Many third parties have no place in our operatories, which leads to interference with the sacred patient-doctor relationship. Executives in boardrooms have no rights to influence diagnosis, directly or indirectly, take any ownership, or guide the future of the healthcare industry. Although they may have had a good run for 40 years in the corporatization of medicine and healthcare, the tides are turning and we must step up to the plate. It's a reset time. In 2020, we have reached over 3 million of our colleagues to the love of continuing education. Let's double and triple that in 2021. Today, we start with medicine, the lion's share of the healthcare industry. Dr. Gerald Morris, you have the floor for 10 minutes to discuss the challenges that our colleagues face in medicine. Please proceed.
Hi, good evening, everyone. I want to thank Dr. Shah and Dr. Letran for inviting me to be able to speak on behalf of my medicine colleagues in the US and also around the world, because we all face the same issues, I'm sure. So I'm a board-certified internal medicine physician. I am practicing here in the US, in Tucson, Arizona. Been in practice for over a decade and have seen a lot of changes that have taken place in the healthcare industry in that short space of time. So what I want to talk about today for my time is just a few of those issues that I think that I have identified on my own. I also talking to other docs that are plaguing our industry. I mean, the first thing I see personally was the lack of the entrepreneurial spirit that we need and needed in medicine. This has led to a reduction in practice autonomy. So for my example, I remember in residency when I was a third-year resident about to go out into the world of primary care, I would ask my program director, hey, you know what, when am I going to learn how to run a practice? And the answer I always got back from everyone who was above me was, just focus on the medicine. And that's good. And we did. But when you get out into the real world, not being able to know how to run a practice is definitely detrimental to your health as a physician and as a doctor by and large. Another thing we saw was the bureaucracy of medicine. We all live in it, whether it's EMRs, whether it's dealing with declining reimbursements, dealing with the health insurance industry. Everything has become this huge 800-pound gorilla in the room that is not leaving enough space for doctors to be able to practice the way they were taught to do all through their many years of schooling. Then another one I tend to see and I actually identify with a little bit is burnout. I mean, no matter what sector you're in, whether you're medicine like myself or dentistry or any other of the other esteemed colleagues we have here, we all experience some level of burnout. And if we look at 2020, that was a specifically tortuous year for all of us here in medicine. And I did some digging, and Medscape did a burnout and suicide report in 2020, and some of the data that they pulled is pretty alarming. After interviewing 15,000 physicians, the docs in the age group 40 to 54, they reported the highest rates of burnout at 48%. And I mean, that's alarming to say the least. And the top 3 reasons they cited was, like I said, the red tape of bureaucracy, the long hours of being up all night trying to document in charts, and the other one was just not being able to be with their families as much as they would have liked. And how docs deal with burnout? Not very well. Almost half of them surveyed isolated themselves, did not seek the help that they needed. And that's alarming in itself. And you found that the majority of docs who were in the burnout mode or who were suffering from burnout were in employed positions. And that's something I want all of us to take a look at and also think about for the long term and the health of the healthcare sector in this country and in the world. Another thing we worry about, and we have seen an issue with, is profession scope creep. Now, what that is that's pretty much, in my opinion, fueled by big corporations who want to put people in positions who technically, or to them, are cost effective in terms of the bottom line. And whether and I mean, whichever side of the aisle you're on, it's important to recognize that when you're a physician or a doctor and you're trained to do a job, this is something that you take to heart. And to have it stripped away from you because, once again, someone in the 20th floor of some big building decides, you know what, he's costing too much, I'll put 3 in his place that cost a third of what he is, just to get the profit. That's not good. That's something we need to definitely fight against. And the last thing I think that we do need to speak to is the lack of camaraderie between physicians and other doctors. We are bred to be lions, alphas. And what happens in residency, what I experienced is you had 3 spots for fellowship dangled in front of 25 residents. And that does not lead to us coming together as a group and saying, you know what, we'll work together to do something. And that's the mentality that has been bred in us from going through medical school all the way up to our professional life. And I mean, I've seen it myself where it doesn't lead to, after residency, being able to grow as a society, as a group, because everyone is thinking he's out for my position, she's out for my position. And that's not the way it is. And what that leads to, more isolation, which we don't need anymore in our industry, in medicine. And those are the 5 ones that I have seen that really stuck out to me in my practice for the last 10 years, things that I've experienced personally, and also talking to other physician colleagues who are dealing with the same thing. At this point, I want to yield back to Dr. Shah to take us to the next speaker. Thank you.
Thank you so much, Dr. Morris. Those were excellent points raised that we hear about. We're going to go ahead and move now to the next profession in dentistry. Perhaps Dr. Letron could give us the blueprint of the issues there so they can be further discussed. With that said, Dr. Letron, you have the floor.
Thank you so much. I am absolutely honored to be here as part of the panel representing dentistry. And just a little bit about myself. I've been practicing for 28 years, graduated from UCLA. I originally came from Vietnam, and I have the blessing of being educated in this country and seeing how the healthcare changed, and now being really part of pivotal part of the healthcare system. In dentistry, I would say there are 5 things. There are a lot of challenges, obviously, for everybody, but I want to mention 5. The very first one is insurance. As we all know, our world has started revolving around a lot of insurance, and the insurance dictates treatment, coverage, frequency, when you can do certain treatment, sometimes treatment choices, treatment limitations, where you can go, whether or not you can see an expert, a specialist. So that's one of the big things that I see. The second one is the competition versus collaboration. We all know that collaboration will help us go further than competition, but sometimes when you're busy, when you're in a very competitive environment, like I'm in Southern California, there are 4 dentists at each corner. Every corner of the street. What do you do? So instead of really chasing each other to the bottom line, which is to advertise for the cheapest, treatment, maybe using the cheapest lab, what can we do to collaborate with each other? And it's really go back to the first one. How do we eliminate some of the third party middleman people so that we ourselves can dictate what we want, and that we would truly just serve the patients and not, you know, the insurance company. The third one that I see is patient education. With the advance in technology, some of us are still lagging in communicating with our patients. This is why the patients go and listen to an ad, right? In Southern California, you could be driving and see a big ad, implant for $399. And I don't know what that cost would cover, maybe my assistant. Because when you do a surgical procedure with high tech, with certain system, you got to be able to take care of that cost, to take care of your overhead, and still have the leftover so you can pay for yourself and take care of your family. So these kind of patient education where it's really is misleading to the patient, thinking that they can go anywhere and at a cheaper place. I don't want to say cheaper is poorer quality. That's up to interpretation, but that is something that we're not doing as well as good of a job educating our patients. And sometimes, especially in dentistry, we spend money on the toys, the laser, the cone beam. We spend a lot of money on those, and then we're not spending money on educating our patients. Maybe you need to invest in a system, telehealth, teledentistry. Let them know before they get bombarded by I don't know how many things out there that are misleading to them, that make them think that they can go anywhere and get the same kind of treatment, where sometimes we hear people say, oh, because you have a quote cheap insurance, that you're going to get bad treatment. And personally, I don't agree with that, because that is a personal choice. And just because somebody have a cheap insurance, the insurance that maybe an HMO, it doesn't make that person a cheap person. I happen to practice in the San Gabriel Valley in Southern California. A lot of my patients are engineers that work for JPL. They are researchers that work at City of Hope. They are teachers that are teaching my kids. So, but they all have sometimes a certain kind of HMO. That doesn't mean that they choose that. Sometimes that's the only option that their workplace is giving them. So it is up to our profession to educate the patient, to let them know that they have options, to let them know that there are different, more than one ways of doing things. And then it's up to the patient to choose which treatment they want. And sometimes what they're going to choose is no treatment. They're going to let that thing go, right? And then we end up taking care of the emergency. But I feel that we are not doing as good of a job educating our patient. The fourth one that I see is excessive government regulation. I believe there are certain basic level of regulation that we have to follow. Uh, the certain industry standards, but sometimes when government is dictating too much, and for example, we were facing a pandemic, and if the government tells everybody to stay home, which I'm okay with that, but sometimes there's a fear factor in there. The patients, even though they are well, they are not compromised, and they got a broken tooth, for example, they are scared. I actually had a patient calling me up and say, Dr. Letran, I need to cancel my appointment because, you know, the governor just said everybody should stay home, right? And obviously that's a personal decision, and I respect that. But I think again, it goes back to patient education, helping them understand that it's very, very important to take care of themselves, and then they make that decision whether or not they're going to be listening to government regulations or recommendations. Up to a certain point, yes, but when it start getting affecting how we take care of our patients, I think it makes it really hard for us as private practitioners. And the fifth one, and I think my colleague Dr. Morris touched on this, is the lack of education for us. And by that, what I mean specifically is in business administration, in business training, we spend years learning our clinical skills, and then when we come out, we don't even know how to interview a staff. We don't even know how to read a P&L. I was very blessed in learning some of those things fast because I was working in busy offices, and I get a chance to observe someone, right? But if I was to start by myself, then it would basically be guessing. And I had the opportunity to buy a practice early in my career. So I was forced to learn some of these documents because I need to understand them in order to make to buy it. And again, if you are by yourself and you're not communicating with others, you don't have the support, and you're trying to guess, or you just listen to uh, let's say social media, or you listen to whichever consultant that you bring in, and that may not be the best person to be advising you, then you are sort of at the mercy of outside influencers. If we have a platform, a program where we can help the doctors understand that, guide them in the right direction, tell them that it is more important to learn the business than the clinical, because you will always get better at the clinical, but the business, unless you start out on the right foot, you could be facing a lot of challenges. And so those are some of the things that I see that are challenging in dentistry. And I want to share that, and hopefully we'll get some feedback from my colleagues to how to deal with that. And I would like to give the floor back to Dr. Shah.
Thank you so much, Dr. Latran. I agree that most of our colleagues face similar challenges, and we will discover that in our roundtable discussion. Thank you for that presentation. Next is a very dear industry to all of us, the medication and the pharmacy that helps heal our patients. Dr. John Kryak will be representing the profession of pharmacy. You have the floor.
Thank you, Keanor, and thank you, Commission. So, one of the things that I see a lot is I see for my first five. So we're all talking about five. I want to put three together, and that would be polypharmacy, unnecessary adverse offense, and lack of communication between providers. So I kind of want to give you a little bit of a scenario. So you have a patient that is going to see that has a primary care provider, and then they're going and seeing 3 and 4 specialists. And each one of those specialists will prescribe a medication. And a lot of times you will see drug-drug interactions that are occurring. And because of the lack of communication between providers, where the primary care provider doesn't want to call the specialist or vice versa, what you see is patients receiving multiple medications, often which interact. And because of that, what you're seeing is an increase in the amount of unnecessary adverse events and hospitalizations for the patients. What I have seen on too many instances is that whenever, even while working in pharmacy, calling one physician or another, there is a lot of I would say animosity or question. Why are you wanting to change my med? That you should be changing that other person's med, or why are you going to do that or do that? And as opposed to actually sitting down and going through the patient's profile and looking at what is in the best interest of the patient. And part of this issue also has to do with the patients and the way that media has portrayed it for many. And for example, if you go to the doctor's office and you are going to be, and you're paying a copay, you expect to get something for that. You expect to get a medication for that. And that is really leading to, and also contributing to, the issue of polypharmacy. it is not uncommon for an average person to be receiving anywhere from 8 to 10 medications. Now, you take that patient and you put them into an institutional type setting, such as a nursing home, or say some of your at-home palliative care patients. These patients can be receiving upwards of 16 to 20 medications. And if you begin to take a look at some of the reports that have been coming out, and what you will actually be seeing in many of the hospitals is, why is it that these patients are showing up in the emergency room? And in many instances, it is because of the fact that they are falling. They're receiving multiple medications, for example, that cause dizziness or can cause dementia, especially in the elderly population. And a lot of it, I mean, what you begin to see is also going back to that issue of polypharmacy, is the prescribing cascade that occurs because of the lack of communication between providers. So a scenario might be the patient goes and sees their primary care provider, and then they'll go and see a specialist. The specialist prescribes a medication. The patient experiences a side effect. Okay, well, depending on what type of side effect they're experiencing, they may go to one of their existing providers or go to another provider, and then they prescribe a medication. And then you start seeing this downward spiral and this increase in the medication, the number of medications that the patients have, all of which, in my opinion, leads to a poorer outcome for the patients and a poorer quality of life. Now, with that being said, now let's address the other two issues that were somewhat addressed by my two colleagues previous to me. Number one, of course, is insurance. But I'm not going to look at it as in terms of for not being paid for. I'm looking at it more of a formulary issue. In the area where I live right now, you've got 5 and 6 different insurance companies, and each one of them has a preferred medication for hypertension or diabetes or seizure disorder. Now, where does that come in? And it's that formulary. Obviously, some of the preferred ones are going to be those that are inexpensive, but the branded name medications, I think there's a little bit of an influence from big pharma, because obviously that drug company that wants to come in and have their medication on that formulary, because that means that when a doctor prescribes a medication, what you're going to see is that it's not covered. So then the doctor has an option, the physician has an option, and that is prescribe one that is similar within a class, or fill out a number of forms or go through a long process for a patient to have that medication. And all too often, what you will actually see is, it's similar. It's an angiotensin 2 receptor blocker. They're all somewhat the same. But there are some subtle differences between the medications, which can be very important for patients, especially whenever you get into the realm of your psychotropics. And all of the previous 4 things that I mentioned, the polypharmacy, the unnecessary side effects, the lack of communication, and the formulary issues, all of which leads to increasing medication costs and overall increased healthcare costs, which is something that all of us pay for. No matter what field that you're in, you can actually see that your healthcare costs are going up. For those of us that own our own businesses who pay for insurance for our employees, you see the costs rising every year and the benefits to the patients going down each year. And why is that? It's because of the overall increase in healthcare costs. And many of those things can be mitigated. I would think the first step, which I will address here a little later, is to have an increase in communication. But so those are 5 issues that I see. And I'm actually pretty passionate about all 5 of those, because the ultimate reason why each of us is here on this call today, or this webinar today, is because we want to improve outcomes for our patients. we are all here to help our patients and figure out a way in which we can do that. So I would like to turn that back over to my esteemed colleague, Keonor. Thank you.
Wonderful. Thank you for that thorough presentation. Passion makes the world go around. That's what we need, is passion about our industries. We have invested our lives and careers to. Thank you for that presentation. Now the next one, vision, diligence. Without our friends, would have a lot of problems in optometry. With the next profession to be represented by Dr. Andrew Royer, optometry. You have the floor.
Thank you, Dr. Shaw. Thank you for the commission for the invitation and opportunity to represent optometry. A little bit about myself. Dr. Andrew Royer. I've been in practicing for 16 years. I've been in multiple settings, the commercial, private practice, starting cold, and now in a multi-specialty group setting. The challenges that I see, I faced myself, and continually see this occur to our colleagues. Insurance is the biggest issue. Insurance affects patient care, patient access to care, and continually increased healthcare costs. There's a number of subdivisions under this category. Reimbursements is the first one. Continual measures are taken to cut reimbursement rates on services, diagnostic tests, and procedures. Just a few days ago, on the 7th of the month, the American Optometric Association reports a joint effort with the American Medical Association and among other groups to support legislation that would stop the pending Medicare payment cuts to optometrists and other providers during the pandemic. This is necessary to halt any payment reductions that could inadvertently limit patient access to care or further exacerbate the financial instability of the healthcare providers. Along those lines with reimbursement goes, I'm sure everyone's has probably heard of vision insurance, similar to dental insurance, medical insurance. There is a significant difference in the reimbursement rates that we are forced to either take or not be a provider for. On vision insurance, for example, a new or existing patient 92004 92014 code. It's the same code that you use with medical insurance. There is anywhere from a 25 to 55% reduction in those reimbursements from a vision insurance. Also, they require bundling of fees with other CPT codes. Also under the insurance would be prior authorizations. Unfortunately, as a doctor, we really are in not much control of what medications our patients are on to treat the ailments that they have. And patients are really at the mercy of their insurance provider as to what medications they can be on. These prior authorizations, the hoops that you have to jump through really affect patient care, and the resources that it takes on a practice are astronomical. In a 4-doctor setting like that I'm in now, we have nearly 1 full-time staff member per provider to assess and handle the prior authorizations. That's not just medication, it's the diagnostic testing and procedures that you have to get the prior authorization for. That can also be very difficult and time consuming. Credentialing is an issue with both optometry, discrepancies with optometry and ophthalmology for the same type of service that would be rendered. Becoming a panel member is difficult. Some insurances will only work with ophthalmology. Some insurances will limit providers to the panel because of saturation in the market. And then lastly, under the insurance would be the covered versus non-covered benefits, discrimination and discrepancies between ophthalmology and optometry on covered services, diagnostic tests and procedures. There are numerous insurance companies that will pay for a procedure, even though it's within the scope of practice for ophthalmology, but they will not cover that same procedure for an optometrist to provide that, where there are other medical insurances that do provide that and provide that reimbursement. The next category I have is state licensure and a unified scope of practice from state to state. If you look at the number of states across the US, you cannot, some states optometrists cannot practice the full scope of their training due to the limitations that state has. You can also, it can be difficult to take your state licensure and go to a different state. So reciprocity. I was lucky enough to be able to do that from a previous state to St. Louis, where I'm at in Missouri. But that's not the case for a number of our colleagues. Next would be online retail and services. The pandemic really put a spotlight on telemedicine. There's definitely a place for telemedicine, definitely in the eye care field and other professions. But we have to be careful on the education that the patients are getting, knowing that this may or may not be a good good enough. I lost my train of thought there. So it may not be a substitute for the true physical examination. We really need to, as a profession, improve our relationship with the medical community, what services we provide as optometry, the benefits that we have acting as a general practitioner almost for the eye industry. There are a lot of things that we can do to help patients with their systemic disease, and reporting that back to the primary care physician for the appropriate follow-up and care with them. Lastly, student loan debt. Student loan debt is a significant problem for new candidates, new optometrists coming out of school. That student loan debt, and I'm kind of going to couple in with lack of practice management experience and education, makes it difficult to go into a private practice setting, makes it difficult to open a private practice right out of school. It makes it difficult, and going into a commercial setting makes it a little bit more appealing when you can have a guaranteed paycheck if you're not fortunate enough to get into a group setting or an existing practice. So those are the areas that I see, and thank you for the opportunity, and I will send this back to Dr. Shaw.
Thank you, Dr. It's fascinating to listen to you and to the colleagues prior speak, as you pretty much have very common, if not the same, issues that we face. And those five were also very, very thorough. Thank you for that presentation. We will get to the solutions pretty soon in our roundtable discussion. The next topic is our friends from the chiropractic world. A very kind and successful business person as well as clinician, Dr. Alan Chong. You have the floor.
Thank you very much, Dr. Shaw, and for Dr. Latran, who invited me to, and the other Hex Commission colleagues. I look forward to working with you and presenting ideas that will both be interesting and challenging. To our viewers, I hope you're getting a lot of commonality and differences from our presentations. I've been in practice, clinical practice, for 33 years, graduated from Canadian Memorial at Toronto, Canada. I now practice in Calgary, Alberta, Canada. So it's a little bit different system, but there's many systems in the world that are modeled and represented here. So I also have, you know, with 33 years of practice, I still don't know it all, that's for sure. But I've seen the profession, our profession, change a lot. And one of the things I've hosted is a podcast called Practice Mastery. And in that, we address some of the issues and talk to other practitioners and other professionals, guest experts, about issues. And there's some interesting commonalities that are coming out. Now, in particular with chiropractic, I've identified 5 major areas of concern in no particular order, but there are some similarities in the first 3. One is that, what is a chiropractor? It's a bit of an identity crisis in a sense, because when I ask 10 people what is a chiropractor, I think the commonalities are that we deal with the spine and that we help people out of back pain. That's what we're kind of known for. But if you go in various different parts of the world, in some parts of the world, there is no such thing as chiropractic because it's been very medically suppressed. And medical societies and organizations have basically shut it down, which is, I believe, is not only a concern, but it's that if that isn't an identity crisis, what is? So I'm not going to go into the details of that, but that certainly is a huge problem. So what do chiropractors offer and to whom is a bit of a unique to chiropractic identity thing. And I call it an identity crisis because among chiropractors, I mean, we're not going to get perfect unity, nor will we get perfect agreement. That's not the whole point. But when the general public in the world does not really know what a chiropractor does, and in some fields of and organizations within chiropractic, there's major disagreement in what chiropractors should be doing. So let me give you a quick understanding from a practicing chiropractor's standpoint, is that we specialize in the spine. However, we also have a lot of training and knowledge in the different parts of the body, if you will, mainly from an alignment and a function standpoint. For the most part, chiropractic is a drug-free, even though there are some jurisdictions in the US particularly, and I believe Switzerland and a few other European Union countries that can actually have limited prescription rights. And then some chiropractors with advanced training can actually perform acupuncture and do dry needling and other things. And then the use of various modalities like laser, ultrasound, interferential current, all those are quite common to chiropractic now. However, the non-prescription, non-drug practice is pretty well it is the most common way that chiropractic is practiced. So, you know, because there's so much diversity, it leaves us in a bit of a quandary that the general public doesn't necessarily know uniformly what to expect from a chiropractor. That doesn't mean that chiropractic hasn't been successful, but mostly in Canada, the US, the UK, and parts of the European Union, Japan, Australia, New Zealand, South Africa, where the schools of chiropractic are, and therefore political influence as well to make chiropractic more reputable, I suppose. And in those jurisdictions, chiropractic has perhaps a more defined identity. Now, related to identity crisis is number 2, and what I call it mainstream messaging. And one could argue that that is the same as identity crisis. And what I mean by that is various different organizations that represent chiropractic across the world, including chiropractic colleges, present a little bit different and sometimes a lot different view of what chiropractic is. So therefore, again, a bit of an identity crisis. And then when it comes to market share, payers, insurers, when there's an identity crisis and inconsistencies, they will define, the payers will define who gets paid for what, or whether they're actually referred to. So the third point there, again, being related to identity crisis as a subpoint, perhaps, the third is public confusion. Market confusion. So a confused market that doesn't know what a chiropractor does, or pigeonholes a chiropractor to only deal with back pain, doesn't know that chiropractors are very good with neck problems and most headaches, and that for the most part we are practicing a primary care and have that primary care role model. However, it's different than the family physician. So I like. And when we get into solutions, certainly I'd love to talk about that more. It has similarities with many of our other colleagues here. The unique thing about chiropractic is, I think, the identity crisis. Now, number 4 is not unique, but the perceived safety concerns of our primary treatment being spinal manipulation and joint manipulation. There's certainly been historically a huge negative bias against referral to chiropractors by MDs and even insurance and providers. And that's been, there are a whole bunch of issues behind that. But in general, there's been a huge negative bias. I see with the current generations of practitioners and even the schools, medical schools perhaps, other schools being a little more fair to our profession, and there's more evidence-based practice. Chiropractic is actually very evidence-based. In fact, not just chiropractic, but spinal manipulation done by chiropractors do the majority of spinal manipulation in the world. We're the most qualified to do spinal manipulation. There's no question that spinal manipulation helps for certain things like back pain, headaches, and certain evidence-based practices. But we know from evidence-informed practice, which I want to talk about next, is guides a lot of our practices for all the commissioners here and you listening and watching, is that we know that experience has a huge value in who you see as a practitioner if you were to seek services for your own ailments. But what is that difference? And it is now being defined as evidence-informed practice. So there's clear evidence, but there's experience that guides the clinician, the practitioner, to actually guide our care and still fall within evidence-based clinical guidelines. But there's a balance. There's a slight, a subtle balance between what's totally evidence-based, which would say, the insurance companies love that because it's 6 visits and then you have to refer it out. We will no longer reimburse that. Now, who came up with those guidelines? Well, it was justified by this, popular research that showed this and this, and therefore our hands become tied. But the patient just wants to get better and they want to stay getting better. So my 5th point is chiropractic education and continuing education is a huge continuum, but it's a bit alarming for me when the balance is too much evidence-based and not enough evidence-informed practice. That takes away the mastery of someone in practice, even for the difference between being in practice as a new graduate or someone being in practice for 10 years is a huge difference. Now, when we start getting into thousands and thousands and thousands of people that we've cared for and helped. We can't help them all, but that certainly gets into evidence-informed practice. And that's why I love the business model and the teaching of and coaching for especially younger practitioners of all ages that need that business practice and success in mentorship and coaching to help them be successful. So quick summary: identity crisis, having 3 points of the messaging, public confusion as to what chiropractic is, perceived safety. Chiropractic is actually very, very safe when practiced by chiropractors that are prudent and keeping their continuing education. And then number 5 is the chiropractic education and the continuing education. So that's my quick summary of the concerns. Dr. Shah, back to you.
Wonderful. Yes, we love our chiropractic colleagues. All doctors are as important as the next. We, as you know, live similar lives and undergo similar training and education based on the scientific method. Thank you for that presentation, Dr. Chong. And now we will turn into something that's very important to all of us, which is the philosophy of medicine and healthcare. Why are we here? Dr. Ora and Boris, please let us know a little bit more about your profession.
Thank you so much, Dr. Shaw. Thank you, Dr. Letran, for inviting me. Thank you so much to all the Hex Commission colleagues. Totally appreciated being in your presence. Well, I think we've gone full circle. So we're coming back to what education is all about. And let's talk a little bit about 2 ideas. As Mark Twain said, I never let schooling interfere with my education. There are 2 different issues there. I've been trained in Romania. I went to school, I got my bachelor, my master, and my PhD. And I also went to school here at UCLA. I've been exposed to 2 different educational systems. And so when we are talking about a certain profession, probably would have to talk about how were we trained to get to that profession. Besides being a college professor and an awarded educator, I also got the so-called, let's say, entrepreneurial bug. I published 2 books. One is called Out of the Transylvania Night. It was an entry for the Pulitzer Prize, and it was endorsed by Nadia Comaneci, the Olympic gold medalist. And the second book actually just came out. It's called Conversations with the Past. And it's a self-help motivational book. And that one was a finalist for the 2020 Best Book Awards. And I started also a magazine called See Beyond Magazine, but also we are going to talk a little bit more in the second part about the magazine that all of us are going to be part of, which is actually called the Top 100 Doctors. So let's talk a little bit about the philosophy of education. Let's really go back in time. I think that all of us remember when we went to high school, right? So we were exposed to a very limited curriculum. All of a sudden, you're given 6 subjects: English, math, science, social science, and then you had foreign languages, maybe PE, maybe cooking, or maybe drama. So you were supposed to decide the future, your future career based on 4 subjects: English, math, social science, and science. So we have a lack of curriculum when it's coming down to prepare our future generation. In Europe, I was exposed to 15 different subjects that have given me the background to really know what do I want to accomplish, where do I want to go, what do I want to prepare myself for. So first problem that I can see, it's a lack in our curriculum. It's how we are going to deliver that, how we are going to prepare actually the future generations of doctors if we are not really going to expose them to what that profession is going to be all about. Second issue, I would say there is really no hands-on exposure. We are really missing, the technology. When we're looking at COVID, all of a sudden the whole instruction has moved on Zoom. People were not trained. We didn't really know how to conduct, classes on Zoom and Canvas and Flipgrid and so many other platforms that were created. And if you really believe that your students knew, they know how to approach social media. They don't really know what the real platforms for educations are all about. So that problem is pretty much we have high demands with limited sources. But we are asking them to go in the world and they have to really have a high GPA. They have to have a teacher recommendation. They have to have college essays. They have to have really high scores for SAT. And then also the school they are graduating from, it has to have a very high API. And if you're not familiar with that, that's the Academic Performance Index of each and every school. So pretty much, your A, actually it's an A, it's not a C, because we are coming from underperforming, school or, middle school. That's taking me to what my colleagues have already mentioned, tuition. Tuition has gone up, I would say skyrocketed. Private four-year schools, the tuition went up 25% in the last decade. Four-year public schools, tuition went up 35%. So let me give you the numbers here. The national student loan debt reached 1.6 trillion in June 2019, according to the Federal Reserve. Soaring college costs and pressure to compete in the job market are actually the biggest factors when it's coming down to students' loan debts. Very many of them are going to borrow, and then they're not going to complete their education. So they're most likely going to default on their borrowing system as well. Then, number 4, and it was already mentioned, I would say it's the mental health problem. This is even before COVID has hit us. Anxiety, depression, it's an overwhelming problem. When we're looking at 2 different drugs that are actually going to be given to our students, to our kids, Ambient and Ativan. Let me tell you from a marketing perspective, both are starting with letter A. Okay, so they're very, very highly recommended. What did we do wrong that we have lost this new generation that's supposed to be the generation of doctors and educators? They are supposed to be mentally healthy. They have issues with self-esteem. They have issues with confidence. And they're really, really lost when it's coming down. What are they going to do? What kind of road are they going to take? And last but not least, was already mentioned, I would say branding, exposure. We're all like isolated islands. We have to come together and form a group, a cohesive group, no matter what your specialty is all about. And that's why I'm so thankful for to Dr. Shah and Dr. Emily Letran and to you guys, for bringing us together. Because I really believe that each and every one of us can be really, really good in his own space. The problem is how are we going to help each other out? How are we going to support? How are we going to inspire everybody else? And that's only going to be done not by staying in your own office, not by staying in your own classroom, but actually coming together as a unit, the way we're doing right now, and inspire all of us and learn from our mistakes that have come from our own specialty, but not only. So thank you so much for the opportunity, and I'm going to give the floor back to Dr. Shah.
Fantastic. Wow. How exciting. The next thing, I'm just sitting back here and listening to all of our colleagues present their case, and it's fascinating how much we have in common and how little we have done to resolve these problems. Perhaps it would be a good idea to go around the table, starting with medicine, and just take a minute or two and explain what commonality you saw, and then we'll talk some solutions and some potential actions, call to actions. Dr. Morris, what's your take on the matter?
Oh, wow. So far, so good. I am loving everything I'm hearing. To touch back on Dr. Imbarros, while you were speaking, something came to mind. We have to think of professional isolation as leading to stagnation. And I think that's what's happening. So we're stuck in our own little bubbles and not thinking about, okay, how am I going to grow as a professional? And I think you made some really cool points there, and I think Dr. Latran also touched on some of that too. So some solutions I think that we can do right at the bat is education with regards to our own profession. I mean, start from young while we're still in training, pre-med or even doing bachelor's, where we train we teach the new generation that yes, get your career, but you have to be able to function as a business if you need to. You have to be able to understand the way the world works. And I think a lot of what we're seeing now with the educational system, and to speak to your model again, Dr. Embarrass, I was trained in the Caribbean. So, and it's fun. You're right. We were exposed. We have the British model or the European model of teaching. We were exposed to a ton of different subjects all through high school. So we were able to make certain decisions, and I think that actually helped me to get to where I am. But my kids are growing up here in the U.S. and they are kind of pigeonholed into some of the way, depending on the state you live in, the education system has to be presented. And that can hurt them in the future because not everyone learns the same way. We've seen that. Each child is different, So I think we need to definitely attack from a young age those of us who are in the pre-part of our careers to be able to understand and function as a proper business once we graduate in the real world. With regards to the bureaucracy of medicine, I think we have to have a long discussion with each other and come together, just like we do here, to make huge changes for our own industry, for the industry of healthcare, for doctors by and large. I mean, like Dr. Shah had mentioned in the beginning, once we come together, we are unstoppable. And we need to be able to harness that fire and be able to move forward. And that once we can do that, will lead to more camaraderie, will lead to the fostering of new ideas, the fostering of new groups. I mean, take for example, if you're like me and you're in training in a residency program and you realize 2 of us are going into primary care, 2 of us are going into GI, and 2 of us are going into cardiology, why not form a group? The patients will need each one of us. Stop fighting and let's just form a group, 6 doctors. You have more buying power, you have more clout, so to speak, professional clout, when you approach certain organizations and say, well, we're 6 doctors, collectively we take care of 300,000 patients. Whether it's through referrals or whatever it is, or we're a group and we take care of this much number. Here's what we need to be able to practice medicine the way the patients deserve. And we can actually can make huge waves. So these are a couple of things that I was able to pick out, but I definitely want all of us to think of this professional isolation leads to stagnation. And that's where I think a lot of us are in our careers right now. Just clock in, clock out. And that's not good. I yield back to Dr. Shah.
That was wonderful. To add a comment about the new generation, business is half of the equation in medicine and healthcare. If a doctor does not wish to oversee it, perhaps medicine and healthcare is not for that particular doctor. And like you said, if a fraction of us come together, nothing can stop us. A fraction, small fraction. These third parties coming in with all sorts of excuses. We relieve daily bureaucracy so you can focus on medicine. We increase access to healthcare. Please be very vigilant about those claims because they're not accurate. The response to these organizations should be, we will allow you to provide services to us a la carte. Tell us what you provide and how you're going to provide it, and we'll pay you for it. But don't take ownership. Don't steal our equity. Don't come into our own home. Tell us how we need to run our home. So these are very important. So be very vigilant with the third parties. With that said, Dr. Gerald, great commonalities. Dr. Latran, on dentistry, did you pick up anything from the other 5 Hex members?
Oh, yes. I think even though we think we're different, we're very, very similar. I think everybody knows that we collectively have let a third party kind of creep into our lives. Insurance dictating anything from outpatient visit all the way to obviously the surgery room. And I think we need to address that loss of control, which I think we've heard that across the board from the very beginning, where Dr. Embarras say, in school, the schools are not equipped to deal with certain things, and the school may not be exposing our students to certain ideas. The philosophy of teaching is sometimes regulated by, let's just say, third parties, a government or donors, or whichever, depending on which institution you go to, right? So we lose the control from there. And then when we go into practice, unless we are paying attention, unless we stay as a continuous student, we lose the control of our practice to the third parties. And I want to touch on what Dr. Alan Chong said, the consumer confusion. They're not understanding chiropractic. Well, it's the same thing as a dental patient, right? Getting confused. Why do I need an implant? Why can't I just have a bridge? Why don't you just take out all my teeth? Why do I have to fix my teeth? And that talks about the common thing that there's a lack of patient education. That, I mean, we are well educated, but for some reason we sounds like we are missing it a little bit there in explaining to our patient what's most important to them. It's not the easiest way right now, unless that's the only thing you could do. But think about their health, their overall health, not just the dental health, or the back health, or the gut health. Think of that as taking care of their whole body, and keeping us healthy as a community, uh, including even mental health. So those are some of my thoughts. I think we the discussion just show a lot of commonalities, and hopefully the solution will solve them all. Dr. Shah?
Thank you so much. That was a lovely rebuttal there on the concepts. You mentioned that the schools are tend to be, what I've noticed, many light years behind. We need to move with modern times and utilize the latest technologies and our colleagues to our advantage in coming together. Autonomy is extremely important. Consumer confusion, we need to educate the patients, and public education is very important. We have a legal contract, a legal and a moral contract with patients to serve in their best interest. We do not have this agreement with third parties. They need to understand that. And when we make decisions based on the agreement that we have with patients, not with third parties. Thank you so much, Dr. Latran. Dr. John Kryak, on the matter of pharmacy.
Thank you, Keanor. So Dr. Morris and Dr. Latran have touched on some very important issues that were not only relevant in dentistry and medicine, but also to pharmacy. So instead of going over and elaborating on what they said, I want to focus on one thing that I kind of mentioned before, and that is communication between all of the clinicians. Right now, even for example, on this webinar, we've got people from various backgrounds and various professions, and having a little bit of communication with having a focus on the overall outcomes for that patient is going to be essential. It's not about whether I'm right and you're wrong, but it's a matter of what can we do for that patient in front of us. And I think that that is something that, as we begin to move forward, and as this group begins to grow and more professionals come in, it's something that can even be resonated within the programs where we learn. In pharmacy school, learned about working with the doctors and working with the nurses, but in practice, that's I'm seeing an increase of it, but there's still with the interprofession between doctor to doctor or nurse to nurse, or whatever, where there might be some people trying to prove their point or show that they're right. But I think that if we all work together and communicate, I think that that is one of the primary areas, in addition to the two that were already mentioned by Dr. Latran and Dr. Morris. So I'm going to turn this back to Keanor. Thank you.
One of the most important topics that was just touched up on was collaboration versus competition. all of our KOLs in our industry that work for themselves and that promote themselves, they are not nearly as successful as our colleagues that collaborate with everyone around them. It's a system, and a system operates best if you have efficiency and effectiveness on how you conduct yourself. So yes, the person down the street, you know, there's a saying that your best friend, your best dental friend is 50 plus miles away from your practice location. That's not the case. The guy down the street is my friend, is my colleague, is a person that understands what I'm doing. So if we collaborate, we're in a much better place than we can be. There's so much work out there. The world doesn't have enough doctors. Okay, so we are not really, there's plenty to go around for everybody. So if we use this reset in the world with this pandemic to create a new system where collaboration supersedes competition, we will prevail. Thank you so much. Dr. Royer, give us the vision of the profession of optometry. Great presentation. Please proceed.
So many commonalities that I see between the different fields. Dr. Karak really touched on, you know, the drug interaction. I believe, correct me if I'm wrong, but I believe the push to move all of medicine to EHR programs was the design for all of them to communicate, and that failed drastically. It's sad that it was great effort, but we need to fix that part. Dr. Morris and Dr. Letran, they touched on the issues with practice management and running the business side of things. Significant issue there in optometry, although there are a few schools that have made advancements in that area, but still much to be done. Let's see, Dr. Letran mentioned the insurance, definitely a huge problem with the dental insurance side of things, same with the vision insurance. And a number of you mentioned patient education. It's so important to get compliance from a patient, for them to understand their disease, how to fix that disease, how to better their quality of life. Patient education is extremely important. And then Dr. Kong mentioned education of the profession and their benefits to the medical community and the general population. Optometry needs to do a better job as well there, and explaining and just explain ourselves, and although we've made great strides in the last 10, 15 years, there's more to be done there on our end, and very important. I see that. I've got a lot of chiropractic friends. My wife went to chiropractic school as well, and just the problems that they face, the education that they have is phenomenal. But you know, unfortunately, they are misrepresented. No, not misrepresented. Misunderstood is a better term. So that's what I have, and I'll send it back to you, Dr. Shaw.
Thank you very much. You raised the point of maximizing communication, utilizing currently we have technological tools available to us to do things that we have never been able to do in history. Experience, as you know, trumps all. You may agree, you may not agree, but if we use our senior colleagues as a stepping stone to the career that we want to build, it's a lot more effective associating with senior colleagues than joining the corporate outfits. Pharmacy based on solid evidence, and I agree with you, Dr. Royer, versus big pharma's narrative is always important to preserve humanity, the humane part of being a doctor, the benevolence, the autonomy. So we need to be very vigilant with these companies and their products and what they do to have doctors promote them. It looks bad on us at the end of the day, not them. Thank you for that observation and the commonalities. And now we lead into chiropractic. Dr. Chong, what did you see or learn from the Hex members?
Well, excellent dialogue is what I say. And the theme that I observed was that we all have frustrations about how do we get back to, as a world, as a country, as a state, as a province, as a jurisdiction, back to patient-centered care. Because let's think about it. If there's 0 patients, we wouldn't be in business, would we? Whether we work for another organization or we work for ourselves in private practice. Now, that's a ridiculous thing to think about. There's always patients. And in fact, there's a growing educated patient base out there. They are more particular, but they are locked. They're more educated than ever. Anywhere in the world, we have a much more educated patient base. Now, do the establishments and does Big Pharma and do other HMOs, et cetera, are they maybe a little bit concerned about that? Well, they're thinking already 10 steps ahead, how still to make money and to cut costs. So that's a huge frustration that I think we've all shared. So my big solution it would be to put in strategies and insist upon patient care. Like Dr. Kriak said, you know, I am so frustrated every single day, people that are inappropriately medicated, but it's not within my scope of practice really to comment on that, because I could lose my license for that, actually. So there's these hierarchies that are established, and I just say, go back to the pharmacist and ask, is that an appropriate, you know, that you're taking 3 anti-inflammatories, right? For example. So, you know, there needs to be gates and gatekeepers that are appropriate, not government and third-party payers that determine what you know, where healthcare is going. So I think from a leadership standpoint, Dr. Shah, Global Summit Institute is taking huge leadership worldwide to not only get that message out, but to have these dialogues. The Hex Commission is a great start to influence others to get mobilized, other doctors around the world to get mobilized to band together, really, where there's power, and insist on change at the bureaucratic level, at the funding level, and at the rollout level.
Wow.
That's what I have to say.
Lovely. This is a wonderful discussion. You know, you brought up the issue of governments. Governments can provide solutions to our problems. Even if public servants and politicians are sincere about their efforts, they don't understand this industry to be able to set policy. Policy should emanate from a body of doctors. We're a lot smarter than these third parties. We have better work ethics. We are actually respected by the public, and we can make a change. So in terms of patient-centered care, this is a very good point. If there were 0 patients, there would be no healthcare industry. If there were 0 doctors, there would be no healthcare industry. But if there were, for instance, 0 insurance companies, we would still have a healthcare industry. Did you know that insurance started in some grocery store, and now they're to a point in their games that they're almost about to overwhelm their hosts. So we will discuss some solutions in that regard, as all members are in agreement that we have a big problem there. With that said, a little bit of philosophy on the matter. Dr. Mbaris.
Thank you so much. Well, I think that all of you guys, thank you so much for, you know, bringing to the table the commonalities. What I've seen, there are 2 things that kind of like stood out on top of whatever was discussed. I think the business flavor of our private businesses, private practices is missing. And I think that's why, you know, coming together to a common denominator actually is going to help each and every one of us out. And then in order for us to be supportive of each other and cohesive, I think we have to change a mindset. You know, I have to look at all of you guys as not my competition, but my cooperation. And I think that's kind of like bringing us to a quote that I really, really like, and I'm going to actually And my statement was that particular quote, it was said by Alexander Dumas in The Three Musketeers, that said, "All for one and one for all, united we stand, divided we fall."
Wonderful. That's funny that you mentioned that, because on our crest, the doctor concept underneath it, and Greek, in Latin says unitas stamus, which is united we stands, and in Greek, divided we fall below it. Thank you, Dr. Embarras. Now, I would like to take this opportunity to open the floor to discuss some solutions. As you guys may or may not know, we spent the last 7 years of organizing the projects and infrastructure for academic, administrative, and financial three-prong approach to the problem. And as a consequence, we had multiple projects and global summits that led to the Global Interdisciplinary Summit in 2020, where at the height of COVID, we brought in experts and speakers, doctor colleagues from 72 countries that presented on the entire spectrum in terms of education that our colleagues tuned into, quality care education, where we exchanged a lot of ideas and so forth. But now we are duplicating and expanding that into all of the healthcare industry. So let's talk some plausible, sustainable solutions as to the most common issues that have been raised, which was supporting the younger generation, insurance, excessive regulation, and all of those topics that we have discussed. Let's start with Dr. Letran, who was very big on the idea of collaboration in patient education. What are some thoughts? You've been around now for, I believe, since 2014 or so, Dr. Letran, and you have seen us grow into different verticals. What are some of your thoughts about the 20+ projects that we have now under the doctor-to-doctor flag? What are your thoughts there? How do you see we have succeeded? What did we do differently?
Well, thank you so much. I think the world can only exist in collaboration if you want to go for long term. And thank you so much for being a visionary. I know it's been a big part of your work, and I joined in a little bit later, but I can see the momentum that we have built up. And now we actually have some concrete programs and platforms that we have created to bring the doctors together. And I'm going to invite Dr. Aura Embarras to speak right after me. The thing is, for example, as far as platforms, we have the Global Summit. We have the Podinars, where we have invited so many doctors from different disciplines to come up and share, right? So all the word unite every Saturday and Sunday, midnight in India. And it's amazing to have 300 groups, Facebook groups, being shared during the 1 hour. And I think that is collaboration. You may not know who's listening to you, you may not know who's appreciating you, but you know that you have the platform to share that. And I think that's really, really big on to have a voice. If you wanna address government or insurance, and if you have a voice to address that, it's huge. And sometimes they're not going to let you on the platform, right? Because it's their platform. So we have created our own platform. You hold the Academy of Oral Surgery. You're training surgical procedures to a lot of GPs. You put on the global summits where you got different speakers come in from all over the world. And now we're getting to the stage of now we're creating a magazine where that is our platform. I don't want to say we can say whatever, because I'm sure Dr. Aura is going to have some kind of control over that. But you can share your story. You can inspire others. You can make it your own thing, and make it where other doctors can freely share and understand each other. And I think that's huge, because whenever you have a platform, your voice just got a little stronger. You got to be an authority to have your own platform, right? And we are blessed to just kind of plug into a platform that she already has. She's going to create one just for us, and it's just for our professionals to have our voice, to let other people know, to let the insurance industry know. You can write an article in there, tell the insurance industry how you really feel, right? And just have them share with their friends, and they can come back to the table and talk to us. So, Dr. Aura?
Thank you, Dr. Letran. Thank you. Well, first of all, thank you, Dr. Shaw, Dr. Letran, for bringing me on board. I've been in the educational field for many years, 22 years, but also I've been working in the media. So I was a journalist in Europe. I was part of Radio Contact, which is a radio station that is very known. I was part of the National Journal, which was in Romania, you know, one branch in Transylvania, where I'm coming from. And then here I pretty much interviewed celebrities on the red carpet in different areas. And then pretty much in 2015, the idea of starting a magazine to serve students and to motivate them and to really give them the voice that they couldn't really find was started in 2016, and it's called See Beyond Magazine. So having Dr. Letran on the cover of my magazine, we started, you know, sharing ideas. And then Dr. Shaw came and, you know, proposed, so the idea that to create a platform, like you said, that is going to represent doctors, but not only. And so I'm just going to read to you pretty much what this, you know, new magazine that we're starting right now, it's going to be all about. So it's a niche magazine presenting world-recognized doctors, dentists, and specialists who promote excellence, innovation, research, organizational leadership, and an elevated entrepreneurial spirit in serving the healthcare industry. Top 100 Doctors magazine launches a new movement for those with the expertise, limitless potential, and the desire to share ideas with the world. Doctors encourage solidarity among healthcare professionals through direct peer-to-peer transparent mechanics and systems. So we actually came up with a couple of columns or sections. And so the very first one is called Doctor to Doctor, that it's presenting solid advice from one expert to another in the world of medicine and dentistry, in addition to the latest discoveries and cutting-edge technology that informs healthcare professionals. We have Business to Business, introducing professionals to successful entrepreneurship and highly acclaimed business models. We have Soul to Soul, inspiring people with stories of enlightenment, education, family, relationships, happiness, intentional living, life issues, spiritual growth, social justice, health and fitness. And then we have the last category, leadership, exploring what defines this new generation of healthcare professionals and their legacy. And like Dr. Letran and Dr. Shaw said, pretty much we are going under the vision of learn one, do one, teach one.
How lovely is that? The magazine will be issued on March 15th. It's a leadership magazine. It's not about being superior by any means. When we did the world's top 100 doctors in dentistry in 2020 and 2021, two different classes of 100 doctors, they're all innovators, educators, clinicians, researchers. And it was about bringing people in areas of authority to the table that can help perpetuate the agenda. So, and what Dr. Letran referred to, what a podinar is, it's a podcast plus a webinar that we have actually coined the term some time back. And we bring doctors to tell a little bit about their story for maybe the first segment of the show. And then it goes into a scientific scenario where we can all learn from their experiences and expertise, be it clinical or be it administrative or be it financial, any of those three in the three-prong approach. So we encourage you guys all to reach out to the doctors that you see on the screen here. Their information will be posted to these links, to the major link, where you can contact them. If you're a doctor that has ideas, or you're excelling in a certain procedure or certain technology, you might want to reach out to Dr. to the doctors here that will be guiding those podinars, that will be hosting those podinars, which the podinar season starts on May 1. Thank you so much. So, Dr. Morris, from the medical perspective,
Yes.
we've been after you guys the most because, you know, you guys have the lion's share, and you guys have fought and fought and fought, and the money overwhelmed you guys. How are we going to fix this?
Well, I mean, yeah, we fought and fought, but by and large, we are still a bit disjointed as an overall community. So I'm hoping that with the events of 2020, as we move into 2021, and with the help of my colleagues here on this panel, that we can definitely begin to make some real change. You know, I mean, I'm part of my Facebook groups where physicians are running, and we do a lot of talking amongst ourselves in terms of, oh, I don't like this, I don't like that. But I mean, only a few of us are wanting to step out and make and kind of force the change that we know we need in order for us to survive within our practice lives. So I think it's going to take baby steps, because by and large physicians are typically hard-headed. So I think if we can definitely show them, you know, more and more of what's available to them out there, especially when it comes to practicing on their terms, I think we'll see some major progress. I want to give you an example. A buddy of mine who was practicing on the West Coast, he is on the West Coast actually. He was part of a large hospital group, whatever, like a one of those big healthcare organizations, and they were paying him X. Okay, so it was the typical, you know, outpatient salary, you know, and then they kept pressuring him to see more and see more and see more patients. And mind you, he is a family practice, you know, well-liked, and he was averaging anywhere from, last time I spoke to him, 20 to 22 patients a day, in addition to managing or helping manage other patients of others in his team. And he was a good producer. I mean, he was definitely bringing in the money, but I mean, they kept telling him, hey, we need more from you, we need more. And he worked 8 to 5, 5 days a week, you know, an employed position. And I think one day he emailed it looks like one of the heads up and said, hey, you know what? I just want to take a look at my numbers to see exactly, you know, what am I bringing in? You know, if you're saying I need to bring more, I must be lacking somewhere. And from when I talked to him, I think it was by accident, they sent him the wrong spreadsheet. And the spreadsheet he got gave him his actual numbers of production for the first quarter of the year that he was working there. And I kid you not, because he actually called me because he was stunned. He had already, in the first 3 months, he had already brought in effect, in excess of $1.5 to $1.6 million. Just his production alone. He had brought that in. And mind you, his salary is a mere fraction. He was getting the typical $140,000 a year as an outpatient doc. And seeing that blew his mind, because then in his mind, okay, how much more can I produce if we haven't gotten to the half of the year yet and I'm bringing this much? So he took it upon himself to resign from that position, opened up his own practice, and now he is living the life that he wants to live, his practice life. And I think that's the shade, that's the green curtain that a lot of us don't get to see when you go into these employed positions. It's painted, oh, you know what, we'll take care of everything, you just see the patients. And I'll be honest, I was part of that too before I went into private practice. And you don't realize how much you bring into an organization until you take a look at the numbers. And a lot of big organizations will not give you the numbers because they know once you see the numbers, you become informed. And when you become informed, you begin to realize, okay, this is what's my worth here to the organization. If in 1 year I can bring in 6 million, but you're only paying me 150,000 and begrudgingly giving me a bonus at the end of every year, what am I doing here? I can do the same on my own, you know, and reap the tax benefits too, because now I'm no longer W-2, my own business. So there's a lot that we need to learn. And it all starts with education. I think if we can drive it home to physicians that, hey, you are master and commander of the ship, whether you're a dentist, doctor, optometry, you run your own, chiropractic, you run your own business. This is how you can benefit from trying and being on your own. And when you're on your own, you're not really on your own. You have a collaborative around you. You have other doctors around you who are living the same and walking the same journey, walking the same path, who can provide you with tons of information and knowledge of do's and don'ts as you step out into the real world. So I think for medicine, we just need to to kind of stand up and realize that we can make change and we can't do it on our own. So we will need the help of our colleagues who are already successful in business and charge forward into 2021. So I look forward to seeing all the great things that the Hex panel is going to provide. And I'm glad to be a part of it.
So, Doc, my apologies. I had to laugh because that contention that the companies, the story they tell our colleagues is just a plain joke. As you know, for a percentage of the collection and a small benefits package to lose all of your equity makes no sense for anyone, because that equity is what pays off your student loans if you need to sell your office, or gets you your new house or your new car, or you want to get married, or you want to get into something else. They forget to mention that they take this equity and sell it to hedge funds for billions of dollars, retirement groups and hedge funds, and then you can be somewhere in China or somewhere in Russia and own a practice in Europe or in America, or some guy that has no clue what they're talking about in medicine and healthcare. But you said we need to get started. You know, baby steps you mentioned lead to building grand things, okay? A journey of 1,000 miles must start with a single step, correct? So
Yes.
we have to duplicate the model that we know works, and for the love of medicine and healthcare and our futures and our next generations, it's incumbent upon us to act, and we will act. Thank you so much. With that, Dr. Krajek, some solutions on your end for the healthcare industry.
Absolutely. And so, you know, just to kind of expand upon a little bit what Dr. Morris had said, you know, I've always been with the premise of the scoot, crawl, walk, run approach. And I mean, you know, I think with what we're doing here today is we are starting the scoot. You know, we are coming together as a group, and, you know, starting at the bottom, and then as more people start to come in, and as you know, many of the professionals and that, you know, all of that, you know, there will be a essentially there will be a call to action for everything that we've got there, and you know, and it starts with us and everyone that is listening to this Podnor right now. Together we can definitely do this, and you know, our voices, the people that are treating the patients, the ones that are actually paying the insurance companies and funding the big pharma and doing all of those things. You know, our voices right now might be small, but they are going to get a lot louder.
Yes, indeed. And those that are funding the third parties, they ought to be concerned. So, Dr. Chong, you know, talk is cheap. Action is what counts. Can you tell us a little bit about, for example, we had one doctor on one of our shows that discussed about how to tackle the insurance monster and send them back to wherever they came from to act a little bit more professional and consider this environment that they're in. What is your thought about this lack of business education? What was our approach to start complementing the lack of action taken by the professional schools across the world?
Right. Well, Dr. Shaw, I think all of us on this commission realizes that professional education is not business education. In fact, it's far from it. I can still remember 33 some odd years ago. I mean, they tried. They told me to, you know, we all had to do a medical legal report. And we had to do a few things, but and those are fundamental skills. However, we're talking about being successful. Two things I would say: your initiative to create a high-end program, which Dr. Letran is the dean of, is the Doctor of Healthcare Business, DHB, and that is a brilliant program for those who want to really learn on a formal basis how to run a business, whether you want to run a multidisciplinary, multiple clinics, or how to be a leader within your profession or your city or your jurisdiction or your town to become not only, for example, the fundamentals, pay down your debt in an organized fashion, to be profitable, how to market, how to brand. And my role in that is to do some business basics, which I'm very good at, like even negotiating leases, and hire professionals to do that type of thing, but know how to hire the people to do the work that you need done, as opposed to just here blank check. So many doctors are great, busy seeing patients, and then therefore great at writing checks if you're in private practice, and that is not the formula for a successful business. So your initiative, and now you probably have some announcements to make. I'm not sure if it's today, but the Doctor of Healthcare Business is an amazing program, which I'm happy to be participating in a small way to teach one of my expertises. Not only as a clinician, that's not going to be my role. My role is actually I'm very good at business and the entrepreneurial part of business. So that's my contribution to this Doctor of Healthcare Business. So take it away.
Wonderful. I'm glad you brought that up. More can be found on drhb.org. As you know, having well-informed doctors with a business mind does not serve these parties well. It's important that we increase our business acumen, our public speaking skills, our local positioning in our communities as the authorities versus, the chains.
And Dr. Shah, I do want to add, for all the listeners and viewers out there, the most practical thing you can do is we are better together. If you believe that movement in healthcare, then it really is easy to reach out to one or two colleagues of yours and ask for help, ask for mentorship. Let's start connecting docs with docs at the very grassroots level. And those who want to take the Doctor of Healthcare Business, then certainly that's a next big step. And it's also commitment. But I would encourage each one of you listening and watching to just reach out to one, two, or three colleagues and share your mutual concerns and say, can we work together on this instead of competing? And they might be in different cities, still a lot of value in that. So that's my bit of practical advice there.
Senior mentorship, very important, Doc. You have to understand that if we pass on from generation to generation without allowing them to infiltrate our industries, it will also be very beneficial. We don't always want to pick up all of the habits of the senior ones. Maybe they have some find the goods and ask 3 or 4 and then make your own. And on we go in this perpetual cycle.
Can I add something real quick? And it just exactly on what Dr. Chong just said. The option of reaching out to a mentor or a senior colleague has always been there. The challenge is sometimes we feel, oh, if I'm going to ask this question, I'm going to sound stupid, right? Or maybe I should have learned this already. I should have known this already. And so the doctorate of healthcare business, what we're trying to do is we want to teach the mindset, right? We want to give everything in a systemized way so you can hit the ground running. Because, for example, if you want to learn in dentistry, if you want to learn implants, you can go to a continuum, you can go to a course, and you learn that specific thing. What if you sign up for Academy of Oral Surgery, where you're going to learn all aspects of surgery, because obviously surgery is one of the things that you want to learn. So that's kind of a difference there, and there is a commitment, but I don't know of anybody who is successful who is not committed to whatever they're trying to do. So in this case, we want committed students to learn, to close the gap between clinical excellence and business expertise, so that we don't have practitioners that when something like a pandemic hit, that they haven't been watching their numbers, right? That they get depressed, they get stressed. Because hopefully, if you're running your business well, making sound decisions based on numbers and have the right mindset, then it doesn't really matter. You're going to go and create your own economy. You're going to attract your own blue ocean kind of patients, and you're going to survive and thrive in anything. So there's a little bit of difference there. It is a commitment. It is an ask. It is a little push. But unless you do that, you're not going to change. So that's
So
my thoughts.
Dr. Letran, on that point, when I was doing an MBA in international business, it was all these things about finance and accounting and stuff that we didn't really need in a medical setting. Our program that we designed is based on the things that doctors actually need to succeed in the supply chain of healthcare. A little bit different, combination programs exist, but nothing like this has ever been done. And it's a good start because what we learned in business, what I took away from my MBA was, in business, always take care of the other person's needs and your needs will be taken care of. If you take this approach, put money aside. People that know us know that we started these 20 plus projects not because we were chasing money. Money is a means to an end, right? So money will come to those who take care of the business needs of others first. Take care of your communities, join the chambers, join the different city hall meetings, go there, start establishing yourself as an authority in your local community. Challenge the public servants about healthcare and what they're doing in the different cities. We are not just limited to what happens in North America. Socialized medicine has its problems with governments. The free markets have their problems with these corporations. Ultimately, if we stick together, we have a solution for all of them. Okay, Dr. Reuter, lay it on us.
I'd just like to drive home the point that collaboration is key. Learning from the success stories and the mistakes of our peers, our colleagues. That's an invaluable lesson that we can put into use in our own profession. And I love the idea of the Doctor of Healthcare Business. That program, where's it been? We've been needing that for a long time. So that's what I have. I'll throw it back to you, Dr. Shaw.
Can I do something?
Dr. Morris, please.
Yeah, so with Dr. Roya's comment, I think I love the idea of learning from others' mistakes. And we kind of have to get out of our own insecurities because, let's face it, we all have made mistakes in business, but being able to share it is a big step. And I think once we can do that, once you're open enough to do that, you'll also pick up something from the other person. So I think it's key for us to be able to, especially when you're reaching out to a mentor, to ask or someone you deem is successful based on how you see their practice is growing. You just want to make sure that you reach out, and if you're the one who they're reaching out to, I mean, don't be you really shouldn't be afraid. Now is not the time to kind of hide the mistakes. We have to be able to say, okay, I did this and this wrong and lost X. So you don't want to do this and this, okay? And with explanation, of course. Because I mean, the most successful groups are the ones that share the knowledge. I mean, and let's face it, that's why the wealthy stay wealthy. They help each other out, in the grand scheme of the world. They make smarter decisions because they're able to help each other say, hey, you know what, don't invest in that. I did it last year, didn't work out. So we as a group, doctors, we need to be able to begin to think like that and operate like that. Dr. Shah can read, Dr. Morris, I wouldn't do that if I were you, because in your market, I tried it and this is what happened. Now, then again, I take his advice with a grain of salt. I may say, you know what, let me give it a try, or let me try this spin on it. And I think the DHB, the Doctor of Healthcare Business, is phenomenal. I mean, I've looked at the program and I'm actually a part of it. So I think anyone who is wanting for that freedom of being able to truly be your own boss is something you should definitely look into it. I mean, it's going to change the world.
I wanted to add to it that the goodwill within us, some of these doctors that came and donated hours of free quality complementary education to others, they did it out of the goodwill of their hearts. Some companies charge them 5, 10, 15, 20 grand for a day to have their time. These guys came and donated their time. Nobody was chasing money. People have that in them. Our colleagues do. So when you go out, or whoever is watching this, if you have something to offer for the benefit of patients and doctors, the Global Summits Institute will back it up. The Hex Commission will back it up. Bring it to us. Let's synchronize. Let's get on the same page. Let's bring these ideas. Ideas are the most powerful thing, not money, not titles, not, what have you. At the end of the day, a powerful idea can change the way things are. and we can achieve that as doctors. We have the stamina. So with that said, guys, I'm starting to head towards final comments. Is there anything that you guys would, let's go around a circle and one final thought from everybody. Mine is very simple. Our doors are open to doctors across the world. We have demonstrated the pilot in dentistry. It has succeeded to the tunes of millions. We intend to expand it into all of the healthcare industries. We remain here for you, with you, and come to us and take that first step, and let's make a tremendous impact for the patients and for the doctors and for the healthcare industry. Dr. Chong.
I would say, for one, thank you very much for having the vision and continuing to have the vision, and to really, I see this more as an overall global movement, Global Summit Institute. And is that where you would like people to sign on to, or like, or what's your best call to action? I want our audience to know that for sure. Where do they go?
So there's only one global summit on Facebook, LinkedIn, Instagram, and the others. And we are going to start alternating just the dental lectures with pharmacy, optometry, medicine, chiropractic, and philosophy, where experts from across the spectrum come and present, and we can all look in. Topics that interest you, it's an open source. There's no registrations and there's no barriers to education. You come in on the scheduled date on the weekends, where we get the biggest exposures across the world between the hours of 7 a.m. and 12 Pacific time, which hits Asia and Europe very well. We conduct these sessions. Soon there'll be sessions in pharmacy, optometry, medicine, and chiropractic. We have done a couple of those. That happens on the weekends. It's free of charge. We bring ideas to Hex Commission members or Dream Team members. There's a very large group of 250 plus doctors working on these projects from the goodwill of their hearts. Bring us ideas, bring us your plans. We will implement them and back them one way or another, as long as they benefit doctors and they benefit patients.
Excellent. On to the next.
Dr. Morris.
I just want to tell my medical colleagues who are watching to have an open mind. I know things may have been rough last year, 2020, but I think moving forward, we do need to have an open mind and take in these new ideas, these things that are game changing for our industry. I believe it's so. And following Dr. Shah and Dr. Letran with what they're trying to put together here, amazing. I think this could be a real game changer and kind of give us back the profession of medicine. Give it back to us. Let us be able to take care of patients the way we were trained to and the way we really, really need to. Back to you, Dr. Shah.
Thank you. Dr. Kryak.
Yeah, so, I just wanted to say, thank you to Dr. Shah and Dr. Letran for organizing this. And for everyone out there, just realize, hey, that you're not alone. I know I would find it hard to believe that there are not thousands, if not hundreds of thousands of clinicians that are out there that are undergoing many of the same issues that we discussed today. We are here, we are small now, but we are growing. So, as Dr. Shaw had said, bring things to us, give us your thoughts, your ideas, and together we can move this forward.
Excellent. Thank you, Dr. Kryak. Dr. Royer?
I would like to say to everyone watching, specifically any of the optometric colleagues that we have, your voice should be heard. If you have something that you feel you'd like to bring to the table, any ideas, we're open, open-minded. Bring them on. We'd love to entertain those ideas. And thank you again, Dr. Shaw, for the invitation and the opportunity to participate.
Thank you. Dr. Letran?
It's always my honor to be part of a panel and to share my thoughts and ideas. I would say it's a new year. Be the new you. Embrace change. We had a little party now this morning, and I say, you got to shrink your butt, right? B-U-T, right? I want to do this, but I don't have this. I want to do this, but I don't have time. I want to do this, but I don't know how. We are providing the platform. We are providing some expertise. Reach out to us. I would say the call to action would be to like Global Summits page to make sure. I think there's a notification when something's going on. You get notified, you check in, you can reach out and talk to any one of us. And we got those platforms like the new magazine that you can write, you can share your thoughts. We got the new program for training. If you're ready for that, and I'm gonna just say it right here, if you want to do it and you're not sure about your time, we're making it very easy in segments of 6 weeks. If you're thinking about the financial aspect, we have the financing companies who can help you with that. It's just like anything that you're going to be investing in higher education. There's a commitment, there's an investment, and I invite you to invest in yourself and your business in this new year.
United we shall stand, Dr. Mbaris.
Well, it is a new year, right? So I think that a rise is always going to happen after a fall. And we are here pretty much, top 100 magazine. It's here not only to listen to your stories, to really promote your products and really support your businesses. So join us. Now it's the time. Thank you so much.
Ladies and gentlemen, on behalf of the Global Summits Institute, its regents, its chairs, its ambassadors, we'd like to thank you for your time of 2 hours today to come to the table. As doctors, we're very accurate kind of people. We work based on small measurements and time. I'm looking on the clock. We are a few minutes away from the 2-hour mark line because that's what we do. We do things with surgical precision. We'd like to make some final notes as to our next upcoming meeting. The next public meeting will commence on March 21, 2021. And that's the first day of spring, as you may know. We shall report back on progress on new projects that have developed out of the mutual combined efforts of the noble professions. Please tune in. Meanwhile, we highly encourage you to either consider presenting on a podinar, which is complimentary to the audience. On a given weekend, reach out to the applicable commissioner who can set that up with the appropriate host, which rotates. And let's begin bringing out ideas. We can overcome all these challenges and get back what was once a beautiful thing, a patient-doctor relationship devoid of interference by third parties. We need that back. Patients want that back. They're tired of going into buildings where doctors are rotating, and let's get back what we signed up for when we went to professional school. With that said, we thank you all for tuning in. We look forward to hearing from you. Everyone's contact information will be placed in the comment section below, depending on the commissioner and the respective healthcare industry. Please reach out to us. Take that first step, and drip, 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 we will build an ocean. Thank you so much. Have a wonderful day. Take care.